The numbers continue to climb, not only of confirmed cases of the new coronavirus out of Wuhan, China, but the number of deaths. In just one day, fatalities have nearly tripled, from 6 yesterday to 17 today. In spite of this, the World Health Organization, after an emergency meeting today, have decided to hold off on declaring this an international public health emergency. Instead, it will monitor this new threat and keep a close eye on China.
Within China, we've asked our colleagues in China to further explain to us what they're doing to better understand the extent of infection in Wuhan, but also in other parts of China.
One of the most dramatic steps that China has taken is that the city of Wuhan, where this new virus originated, has now essentially been quarantined. This means beginning Thursday, the population of 11 million will not be able to leave or travel within the city. Trains, planes, buses, subways, and ferries are being shut down in an effort to contain the outbreak that has sickened about 500. The vast majority in China, but several in other countries as well, including one in Washington state.
I think we probably will see at least a case of this new virus in Canada.
Infectious disease specialist Dr. Alison McGeer says if the virus spreads to Canada, we're ready for it. And while there's a possibility of this becoming the next global pandemic like SARS, which caused 800 deaths worldwide in the early 2000s, the likelihood is very low. She says we must be careful not to be apocalyptic about this. For some perspective, consider the fact that the flu has killed as many as 17,000 people in the States in the last 4 months alone, which translates to around 1,700 deaths in Canada.
You're absolutely right. We should be worried about influenza. We probably don't need to be worried about the virus in China. We all worry about things that are new and that are foreign and that are uncertain, and the new coronavirus checks all those boxes.
It's good news that so far, while there's evidence of human-to-human transmission, there have been no documented cases of secondary transmission, as in human-to-human-to-human. Here in Ontario, as many as 2,000 people traveled here from China per day. 3 airports are going to begin screening for the virus, and a handful of people have been tested. All have been negative.
We will continue to diligently monitor this issue to ensure that Ontario is prepared to identify, contain, and treat any potential cases of this virus.
One challenge for containment is that this is the world's busiest travel time. Hundreds of millions of people travel to or within China for Lunar New Year. The WHO's Emergency Committee will meet again tomorrow for another discussion on this complex and evolving situation.